So our sixth mental health, sixth innovator, and our third mental health company is Wysa. Presenting for Wysa is Jo Aggarwal, the co-founder.
Awesome. I'm just seeing, a trend here. And the first few presentations were of sort of organizations from developed countries doing health work in South Asia, and the last few and ours are South Asian organizations that are expanding across the world. So I continue the trend of an Indian organization that's trying to address global mental health. What I started this whole journey, I'm not a psychologist or a healthcare professional. I started this journey from my own personal experience with depression. I'm a technologist, and which left me with just one question, saying me and a lot of my friends were using AI to do marketing and sell stuff. And I said, can we actually sell mental health support using AI? And Wysa wasn't the first output of it. It was almost an accidental discovery that this works. What we started out by doing, like most tech folk, is saying, can we use the sensor data from a phone to detect if a person is depressed? And we actually ran trials in semi-rural India and found that actually, yes, you can actually take some of the a smartphone, but a not very expensive smartphone, and you can actually take data from it, which is not very personal. So the gyroscope, accelerometer, the anonymized locations, and so on. And you could, to a 85 to 90% accuracy, predict whether a person is, or at least classify if a person is depressed or not. And we're quite thrilled with this. And 3 months later, we went back to the primary care physician that we had done this trial with, who was following up with these patients. And we said, what happened? Did we help anybody? And they said, well, one person took therapy. We had detected 30 people in that small trial out of our patient pool of 100 people. And one person had taken therapy. Now, to do this, we had actually created a chatbot. A small chatbot in which we had put this technology that would capture sensor data. It was almost like a Trojan horse. And the same people who were not willing to see a therapist for various reasons, access, cost, stigma, were more than happy to talk to this chatbot. At that time, it didn't have AI, it just had multiple choice. It was in 3 languages. And 3 months on, they were all feeling better. So that sort of woke us up to say, is detection even that much of an issue? Can we actually scale mental health by giving people something that they're willing to talk to? And we sort of flipped it from saying, how can we improve healthcare, to saying, how can we bring user agency back into mental health? And it was a big realization, both from my own experience with mental health, and I think this was a big wake-up experience, to say at the end of it, the stigma, the lack of access, the biggest issue is that people feel like admitting this issue or working on it will take away their agency. And we have to therefore find a way in which we can massively scale reach and engagement and give people a sense of agency over their own well-being. And not in a way where we have to have a doctor prescribe it and so on. And we have to still do it efficiently without adding millions of therapists or coaches or counselors, because as you've seen in the previous 2 presentations, and likewise in India, we just don't have any professionals. And that's not just true for India. That's also true for the UK. That's also true for the US. In the UK, the waiting lists, in Canada, in a lot of these public health countries, the waiting list for mental health run up to a year. So you can go in with suicidal ideation, attempted suicide, and not see a psychologist for 14 months. During that time, of course, people get worse. Now, how do you put something which has got engagement, which does it efficiently, doesn't need a lot of therapists, but still achieve the kind of efficacy that a clinical intervention should achieve, that it actually helps and has all the rigor of it? And that's sort of what we started out realizing, that we had the seed of it in this simple chatbot that we'd built. And this was 2017, early 2017. And 6 months after actually working on this and building this, we got a mail from this 13-year-old girl somewhere halfway across the world saying that this was the only thing helping her hold on to life. She was depressed and she had tried to commit suicide. And that's when we realized that we were on to something. We really needed to make this clinically effective, proven, rigorous, and this was a hypothesis that bared for us to explore more. And as we explored it, this is what we found. Remember, what we're trying to do is try to scale mental health in a way that bypasses stigma, in a way that bypasses lack of resources. These are the two big issues that even other presenters have talked to you about. And what we found, and now there's lots of other published research that supports this, but we found directly by experience, is that people have no stigma in talking to an AI chatbot about their mental health issues. People actually want to be heard. Now, why AI and what does AI do here? It's a very interesting thing. There is absolutely no, if you think of an AI chatbot, you'd often think of something that's self-generating ideas or coming up with things to say based on what people are saying to it. That is not what Wysa does. I'll talk to you a little more in a bit about how Wysa works, but AI, so that it does something called NLU, natural language understanding. It allows people, rather than pushing buttons and selecting columns from worksheets, it allows people to just vent and talk about what's going on in their mind. There in itself, in that first action of taking all the emotions, feeling in the first 15 seconds, what a therapist takes 2 sessions to get to, a sense of safe space where they can actually open up and talk about everything that they want to, feeling that safe space, articulating it, journaling it to a bot, that's the beginning of therapy already. Often we have found, and I'll talk about numbers in a bit, in this free AI chatbot, we do not charge for this AI guided self-help. And in this free support, often in a matter of 10 minutes, people have discussed their issue, found what the fallacy in their thinking was, reframed it into a positive thought. So they've done a cognitive restructuring exercise from CBT, very much as the worksheet would have asked them to do. And they walked away saying they're feeling a lot better. And this is one chatbot that can achieve this at no cost, hardly any incremental cost per person. Now, it's true that not everybody will be able to manage their own emotions. There are people who are dealing with issues which they are in a position to have self-help. There are also people who absolutely need psychiatric support or need in-person support from a psychologist. Now, what the AI-guided self-help can also do is provide an escalation of care pathway. So it also says, for instance, for somebody who's talking about suicidal behavior, at-risk behavior, somebody who's mentioned panic disorder, abuse, a whole bunch of different conditions, but also highly distressed by the same condition over time and unable to help themselves, it escalates them to say, you should probably talk to an in-person support, but if you can't, here's text-based therapy. Now, text-based therapy is not quite as large scale as a mental health professional, but it has 2 other things going for it when you think about it from a user's perspective. One, it can still be anonymous. You still don't have to tell anybody who you are. And 2, it's something that you can do even if you're sitting in the middle of a room. Now, imagine a teenager at home, you're sort of sitting with your friends, you're sitting with your family, and you're texting. That's a very normal scenario for most people. If you're texting your therapist, they don't need to know. So nobody else really needs to know that you're texting anybody except a friend or you're on Snapchat or whatever. And that kind of a safe space and safe environment has been critical for people. There have been some people who are so unwilling to be seen as being weak that they only text when they know that the therapist is not online. and others who really have good live sessions. But we can, through this, bring down the cost of providing this therapeutic support without compromising impact. Having people work through and having great follow through, people working on their issues for years on end if required, but many of them at least going through the 3 months of support and sticking to their regimen. We can do that where one therapist can support 200 people. And also this therapist can do a triage in just one text therapy session or two and say that this person actually needs to go up to a face-to-face counselor or be referred to a doctor or a psychiatrist. So that's sort of the care pathway that we have arrived at. And in each of these, there's lots that we have innovated. But I'll just go to what we have achieved doing this. So we launched in early 2017, late 2016. It's been 3 years.
I was just saying that we're at time. So yeah, if you could wrap up quickly, that'd be great.
Yes, of course. So far, a lot of people have used us, as you can see, 1.7 million users, but we've had 1 million breakthroughs every year. So 1 million cognitive restructurings annually for free. And that's the kind of scale that we've achieved. And I just want to add one more slide and then I'll wrap up, which is that this has to work if it is actually clinically safe and it has had its effectiveness proven. So we're rated by ORCA, which is NHS's rating agency for health apps, as the highest ever on any health app on clinical safety. We're rated 100%. And it is the app that NHS promotes to all of its patients who are pre-diagnosis or don't meet criteria. But it also, we've published effectiveness of a chatbot to say that it actually has help in depression. I'm just going to, these are some of the other things that we can do in terms of trying to make NLP AI health ready. And I think one thing that we are able to do is make it voice ready, make it free text ready, which means that, and localization ready, which means that if you had a need where you had to provide this kind of support over voice on a phone or over SMS or USSD, in a local language, in a developing country, we're ready for that. We're here to look for partners that we can do that with. Thank you.
Great. Thank you so much. So a few questions from the audience. I guess, how do you maintain the ethics of privacy in these healthcare-based apps?
That was, I think, our first issue. So when we started out, we said this is user agency and whatever the user agency wants has to happen. So the first thing is there's absolutely no personally identifiable data collected by us, let alone, you know, for us to keep it safe, if somebody tomorrow hacks us. So everything on this app, including when a person accidentally gives us personally identifiable data, we automatically redact it before storing it. And from another point of view, you also have to be careful that, for instance, if this app is something people are beginning to depend on, then if it goes down and they then struggle, then we have to make sure that we've met all of the standards of clinical safety, both if a person is talking about a suicidal issue or if a person is just dependent on it and the app is going down and they should not be triggered in any way. And that's what we do in terms of our standards of DCBO 129 and clinical safety, etc.
Great. I think we have time for one more question. So I guess I'd like to ask a question that I posed to Claire. Is sort of, you know, you've got an innovative network here as your audience. How, you know, what is, you know, I guess, how can we help in with your expansion strategy?
So right now we have two types of strategies. One is to work with pharma and healthcare in developed countries with insurance providers, etc. And that's going quite well. But there is something that we created this for, which is to create global impact. And we really need partners. So for instance, partnering with someone like Maya to be able to provide our power in addition to their ability to get users would be amazing. To partner with organizations in different countries who are working in developing economies, who have figured out the grant ecosystem, have figured out the last mile, have figured out user you know, how to support people on an ongoing basis, we have technology that we'd love to partner with them on and make sure this really scales.
Well, thank you so much for your time and for presenting Wysa. Fortunately, we're out of time, so we'll send those questions on to you by text, and maybe you can answer those. So